loved one in a senior living community, you know how hard it can be to feel connected and informed. Next up, we have Dr. Julian Brinkley, founder of Quick Connect by MyUI.ai. That's the innovative Clemson, South Carolina-based company that's bridging the communication gap, giving seniors more independence and improving staff efficiency so they can spend more time on care, not paperwork. That's what we want to see, Dr. Brinkley.
Yes.
Explain how this works and why you decided we even needed something like this.
So this work is basically something that originated with some of the work that I do in my lab. So at Clemson, my research exists in the intersection of human factors, automotive engineering, and computer science. So we really spend a lot of time trying to understand how to develop technologies that support older adults. So this technology was developed to basically use AI to provide a more comprehensive ecosystem for older adults in senior living facilities.
And AI gets such a bad rap of being used for negative things, but we're loving to see how AI can be used to help make life a little easier for our seniors. So tell us exactly how it works. We all want to get rid of less paperwork and more time enjoying activities. How does that impact and work with our senior community?
So we have it deployed to a couple facilities currently. Right now, they're primarily using it to schedule activities. The way the ecosystem is designed to work, residents play games, small games on the kiosk. We feed that data to a machine learning model that's deployed to the cloud, and then the kiosk itself basically adapts, conforms to their individual usability needs. So that's fundamentally the way it works. In terms of what it's being used for currently, we're primarily using it right now for activities, meal ordering, service requests, all of those resident-facing type activities at senior living communities.
How can other senior living communities be like, I want to jump on this train, I need to do this?
So if they reach out to me directly, we have, we're working actually on a book that's going to report out some of our findings from working with a lot of communities. We're currently looking for communities now to basically pilot and trial the technology. So there's a lot of opportunities. So they can reach out to me at julian.brinkley at quickconnect.health.
I'll have that on our website so you can see it. And you can see in the picture too, because we had this kiosk, we just didn't have the staff to bring it in this morning. So is that kiosk what would actually go into the places? People get that?
Yeah, so the facilities themselves have access to a web-based portal where they can essentially monitor all of the activities being registered for, the meals, everything else. So it really works very well for the directors and the management staff at facilities. The kiosk itself is basically one of the touch points that the residents would use. So they would use the kiosk or a companion app that they can download onto their smartphones to basically register for activities and do everything that they would do in the kiosk.
And it's good for the caregiver too to be able to have that type of real-time information too about eating meals, what activities you're taking. It probably gives that peace of mind to the caregiver as well. So great information.
Well, technology can get confusing sometimes, but that looks like a very easy way to use it, and maybe they're not intimidated to try things on their phone or.
Yeah, it's very easy to use technology. It's designed with usability in mind. The first facility that we've deployed it at has seen activity registration jump significantly because residents receive reminders. They get away from a lot of the paper-based processes that are used at many facilities. So it really creates an opportunity for these facilities to spend much more time on resident care, which is what they're passionate about. So
well, congratulations on it. I'm sure it took a lot of work to get it to that point, right?
Yes, so smart, using AI and technology for good. Thank you so much, Dr. Brinkley. We appreciate you coming here. QuickConnect.health is where you can learn more. We'll have that on our website along with his email. And that's a wrap, y'all. It's time for us to go.
Yeah, we'll see you tomorrow for our Friday show. Have a good one.